And we're back. I'm your host, BKP. Good morning from beautiful downtown Blue Ridge. The Vault, we're just a couple days, it's Friday, just a couple days before Christmas, so we're going to say Merry Christmas. This will be our last live show until next year, but I'm happy to be joined by Dr. Raymond Tidman. And
Good morning.
We want to thank Georgia Cancer Specialist for this segment. How are you doing, sir?
Very good.
Merry Christmas.
Merry Christmas to you.
And Merry Election.
Yes.
Post-election. I have not seen you, Dr. Tidman, since the last time we were over Sycamore Crossing, pre-election.
Well, you've missed a lot of smiles, so.
Did I miss a lot of smiles?
Yeah.
Hold on a minute. Hold on. Hey, Mindy, could you do me a favor? I'm tired of hearing Cole cry. Could you get his order? I mean, that's all I keep hearing is, what do you have on the menu? What do you have on the menu? The poor guy's starving to death.
We're afraid he's going to pass
Yeah,
out.
we're afraid he's going to fall over any minute. Anyhow, Dr. Tidman, did we have any bets? Because, see, I've got people paying off cigars left and right, and I can't remember if you were on the list.
You know, it's funny you asked that because we should have, but we would have been betting on the same side. But I have a great story about that.
Go ahead.
So one of my consultants, this was 6 months ago, during the really difficult part of the election, made a bet with a friend. These are obviously some well-to-do people to make this kind of bets. He bet him 8-1.
8-1.
That Trump would win. And I think the initial
Taking
bet,
odds.
I think taking odds, and I think it was a $2,000 bet.
Wow.
And then in the month before the election, when all that bad news was breaking, his friend said, "Hey, do you want to double down?"
Not double
And
down.
he doubled down. So do the math in your head what that payout was.
During the
That's
break-
that's the biggest payout I've heard. So
During the break, slide me that name and number. I need a loan. Double down. That's pretty good. You know, jokingly, before the election, and people that know me, know I was confident in it. I would call people and they'd say, "Well, I don't know. It's going to be." I said, "No, it's going to be a landslide." Because one, not get down the rabbit hole, but I actually understand the Electoral College now. I'm not a professional on it, but I understand it, and I understood the path was, and that if we just wanted to get New York, Texas, Florida, Texas, and California, then our founding fathers, or when the Electoral College was put in place and organized, then Georgia would be irrelevant, Kansas would be irrelevant, and they wanted the president to be the president of the country.
You know, another piece along that line, this obnoxious audit that they called for. Well, they got into the Detroit voting.
Everything backfired on that.
Backfired on them, but I mean, what was this county? 80% turnout, very high turnout. What did they have? 110% turnout in Detroit. So how do you do that? And it was all for one candidate. I mean, that just speaks to there's something really bad going on in the inner city precincts where there's not good eyes on what's going on in the polls. That has to be fixed in the future. I don't know how we get our head around.
Well, that really upset Chicago because they were always they always led those statistics, and they're really upset in Chicago, and they're upset that Detroit
beat them with number of dead voting.
Yeah, exactly. That humorously, and I want to get into some serious stuff, but before the election, I felt Wisconsin. I would say rural America is going to win this election, and I tell people that all the time. And I'd have people, well, I hope you're right. I want you to be right, but I'm just not feeling it. And so I made a couple minor cigar bets, and my humidor looks better than it has in 10 years. We'll leave it at that. All right.
Yeah, go slow. Go slow with that.
It looks better than it has in 10 years. Last time we were together, we talked about, it was pre-election, and we talked about, because you are, I will call it, we're in rural America, and you have a practice here, and this is hitting home right here. You have a practice, and you know the intricacies in detail what the Unaffordable Care Act is doing to the local practice in small town America, and we talked about that. Now we have the election, and we have the appointment of Tom Price, HHS Secretary, and I always say it just for those out there, that's Health and Human Services, and he's a 6th District, I think, Congressman from Georgia here, so we're proud of that. Now I'm going to give it to you. What do you think of his appointment? what will he put in place, and how will it help the patient, the doctor, put it all together for us?
So let me give you a little personal small world fact first. Dr. Price and I are both Michigan transplants to Georgia.
Okay.
And he and I both went to the same high school in Michigan.
Okay.
We were a year apart. We didn't know each other. But it's interesting that...
Does he pick up the phone when you call?
Oh, no.
Just want to know.
But
we get him on the line.
That's kind of fun. I'm excited about Dr. Price's appointment because it just shows how serious President-elect Trump is about changing things. Kind of backing into what I was talking about last time, the problem with where medicine and financing has gone is that it's all about the insurance company, and the doctor-patient relationship's lost. And we have to undo that. It just has to be undone. Insurance companies are good for insuring for catastrophe. You know, when you buy insurance on your car, you don't buy insurance to change your tires, you know, to change the oil. You don't get insurance to do the routine care that a car needs. You get insurance so if the car gets crashed or totaled, you're not out an economic disaster. That's the way insurance should be in healthcare. The solutions in healthcare that he's looking at, the savings accounts, all that stuff puts the control of the money and the spending back into the consumer's pocketbook, so that they are now policing my industry. An insurance company has really they actually have a perverse interest in price control. The more money they're handling, the more money they're making.
Right.
So there's no reason why they don't wink, wink, nod, nod, let prices keep going up and up and up. Now, they'll come on TV and they'll talk about all these price controls, but it's always to their favor. They're always paying the doctors and the hospitals less, charging the patients more, complaining that everything costs more. Well, the only thing that's costing more is to the patient. The solution with the health savings accounts is that for the day-to-day expenses of healthcare, the patient's now in control of that. And they're asking the other doctors, is this the best way to spend my money for what we're trying to solve here? And doctors will respond appropriately. They will look at that and they'll say, no, we could do this over here a little bit cheaper, or we could wait on that, or there's another way to skin that cat. So the economics comes back into the exam room between the doctor taking care of the patient, and that will automatically start correcting or bending the curve on cost.
Well, you know, last time we were together, there were so many things that we were talking about that were involved in the Affordable Care Act. But one of the things that stuck with me after we left that day through many was you, as the physician, being very upset of all this bureaucracy that came between you and your patient. And you, am I going down the right road?
Oh, absolutely.
You want that out of the way. As a
Right.
physician, you want your relationship to your patient, and you don't want that in the way. And that was something I meant just.
Well, I mean, let me put a real poignant, you know, when things are current on your mind, you're thinking about it. Now, I won't reveal any names,
Okay.
but yesterday I had a case of a senior citizen, widowed, lives alone, in her upper 70s. Daughters have come back into town. They're worried about her because the mom is very thin now. She's lost 35 pounds. Every night she's calling the EMS. Every other night they're coming out checking on her. Frequently they're taking her to the emergency room because she's dehydrated and obviously in trouble. Every time she gets to the hospital, they evaluate her, they give her some fluids, they check some labs, they send her back home. Well, I mean, this is a senior citizen who's failing to thrive. We did a careful mental status exam on her, and she's at 1/3 her mental capacities of where she should be, okay? Now, when you sit there and talk to her and have social interactions, that doesn't come out. But when you have her do simple things like draw the face of a clock and show you what time it is,
Right.
or name outlines of animals, or do simple calculations, she's not there. That's gone now. So she is at risk, she is at home, she is alone, and she is now under 100 pounds. Okay? Well, every time she goes to the hospital, they look at her, well, she doesn't have pneumonia. They can give her some fluids and rehydrate her. She's obviously not having seizures or mentally, you know, having a stroke or anything. So they send her home. There's no criteria to admit her. She needs to be admitted, and they need to find a nursing home. She cannot live alone anymore. She either has to go to a nursing home or go to a family member, and there are none locally, or she dies at home. Worse, in a fire where she forgets and leaves the stove on. That's the rule making. And that's a Medicare. The rule making of the bureaucrats saying to the doctor in the emergency room, look, if you don't meet these rules, you cannot admit her. Well, the doctor in the emergency room knows that this is a bad situation. I know it's a bad situation. The family knows it's a bad situation. But you're dealing with the bureaucracy.
The rules.
The rules
the
of the
makers.
Rule makers of the bureaucracy, who probably didn't intend on this to happen. But of course, they always think that, I guess it's not my mom, so it doesn't really matter. But the rulemaking is going to have this lady die a bad death at home. So we're doing everything we can to find a reason that meets their rules to keep her in the hospital.
Well, you know, sadly, I want to say this to you. I understand 100%, and that hit home with me because my grandmother lived with us for 8 years before she died at 82, and she lived with us for about 8 years. And the thing is she had a couple strokes. Now, just like you say, if you sent her to the hospital, they'd rehydrate her, the whole list. But, you know, we would always say, you know, because we had a gas stove, and Grandma liked to get up and cook, because she cooked her whole life. So she wasn't going to stop cooking. So it was not uncommon that we go in there, and Grandma was cooking, unaware that the dish rag she was holding was on fire.
Yeah.
Like, Grandma.
Or walked away and left the skillet on the...
Right.
Yeah.
And so anyhow, that really hit home, but we were there. We were fortunately, there was a dozen of us in the house, I'll just say it like that.
Right.
We were the mini Waltons, but there was a dozen of us there. And, you know, so we were always able to catch that. So what you're saying is the rule makers, that hit home with me.
Yeah.
That really hit home, the rule
Well,
makers.
it creates this, you know, the people who support all that act like they're caring, but acting like you're caring versus caring is two different things. And you have to look at outcomes. You have to look at what the results are. And when you see the results of this kind of thing over and over again, you realize that there is no caring in that. And that comes back to my summation of why, quote, Obamacare is a disaster. Because my grandfather taught me there's nothing free in life. Okay? I learned from that when you've got somebody offering you something free, you need to turn around and walk away, because there's something up there, right? Put free with care. Caring is something that is a very important high-level experience. You don't care for someone unless you really intend on it. So when somebody's offering you someone else's care for free, that's close to evil to me.
Okay, I'm not laughing, but I mean,
you see where I'm coming from?
Exactly.
So I think that's why, from the very beginning, when they talked about that everyone has a right to free health care, well, there's nothing free in life, and it's someone else's caring.
Well, you know, I'm going to say this, and I could just stay all day and keep breaking this down, but if you break down the words, it's health care. And the care part is somebody needs to care for you or care about the situation or care about you. And I see all too many times people say, I keep taking, you know, because we go on social media because that's, you know, what we do in our business. And I all too many times see people post, I keep taking mom to the hospital. And we're not being negative to the hospital. I'm not saying this hospital is bad. Right. But I keep taking mom to the hospital and they just keep sending her home.
Yeah.
You hear that all the time.
All the time. And it's the rules that they're having to live with, because they'll get severely punished if they break those rules.
Right. So. Let me change direction just a little bit. Tell me, all right, let's say you said that by Tom Price being picked as HHS secretary, it signaled to you that Donald Trump was serious with especially this one particular thing when he was telling people repeal and replace. It signaled to you as a physician that he was serious about it and who he picked. So why was he, what signals in that his pick says he's serious to you? And another thing I'd like for you to touch on is alleviate the concern, if possible, from a physician that people are saying, well, they're just going to kick 20 million people off their health care. And can we do anything this morning to tell people out there, you know what, don't get all nervous. If you do have the Affordable Care Act, Tom Price, you know, you don't know anything inside, but Tom Price is not, they're not just going to kick you off tomorrow or something like that. Can you go in that direction
Well, I mean,
a little bit?
I think you come back to the greatness of the American healthcare system. It's full of really good people, really good nurses, really good physicians, good administrators. They're good people, okay? They care. They are going to provide the care. Now, it may kick them off of some insurance companies.
Okay.
There may be a lot of displacement in the insurance companies. That's necessary because because this has become a system that supports and is all about insurance companies. That has to change. It has to go away. So yeah, it's going to seem somewhat scary, but you still are going to have all of these highly trained, caring people out there who will step in and make things work. And I think that's my optimism that we'll get through this. But it is going to be hard. Now, I heard you talking about coming in, draining the swamp. The number one draining part of the swamp is the inability to fire people. Now, you look at Europe where they have all these labor rules and stuff, and I'm not this ruthless, you got to fire people all over the place. And it's interesting, we have Donald Trump, who was famous for saying, you're fired. But when you look at department by department within the United States, where things go wrong is that you have too many people who have been collected there who are either incompetent or malicious. And they're there doing wrong and bad things, and no one can fire them, even when it's obscenely wrong and obscenely bad. And somewhere that system has to change. Now, that's a hammerlock the government employee unions have over us as people and our government. But I don't see how you solve this problem as long as people who are responsible can make a firing occur, particularly when you've got a person in an employment position who is doing wrong. You know, it's dysfunctional.
You know, going down that, let me just say this past week, and this is not healthcare, but this past week I read an article, and there's some uproar in the national NSA, okay, that the NSA is seeing a record number. As you well know, when you leave office, one president and another president takes over, these bloated, massive agencies have thousands of people that work there that continue to work there. Mm-hmm. They don't get fired. You have a core group that gets appointed by the administration, but you have the people that are running the data center and so on and so forth and pushing the paper. They go to work every day. The point is in this article, it's alarmed some people, not myself, that they're having a massive amount of resignations of not the appointed people that are going to resign, but people that generally stay over in administration. And that article it's a concern that many people are resigning. And I looked and I said, no, the reality is those people know they're going to have to go to work now. That Michael Flynn's going to walk in, General Michael Flynn, and these people are going to walk in the NSA and say, no, you're going to work, and they're getting out. Yeah. Some of them are getting out and looking for somewhere else to go because they're going to have to go to work. But being able to be fired, I want to get back to healthcare, which we got a couple of minutes here. Don't want to rush you out of here. But Tom Price, many people, we want to be clear to our viewers and listeners out there, many people don't realize that, and don't want to get this into a Republican-Democrat thing, but on the Republican side of the aisle, Tom Price has had a plan for quite some time, for several years.
That's why I feel strongly about Tom Price, because he has been a champion of coming up with plans and thinking through this and working it out. He's not a newcomer to this that's going to just say, hey, let me run back and think about this for a weekend. This man has been seriously studying this and has been in the Congress long enough to have some notion of what he can weave through there and how he can make it happen.
And he's Dr. Tom Price.
Yeah,
He's Dr. Tom Price. And I'm not for sure, I'd have to look it up, but when we got the Affordable Care Act, we had Kathleen Sebelius, and Kathleen Sebelius to me is the former, I don't know about her medical, if she ever had any, but she was a former governor of Kansas, and she's the one that promoted, the Unaffordable Care Act. Yeah. Tom Price is Dr. Tom Price, and they have a plan.
Yeah.
Absolutely. So I missed a lot of smiles.
Yes, we had a lot of smiles, and we even had pizza on that Wednesday morning. So.
Had pizza on that Wednesday morning. Anything else concerning this administration? Not just the Affordable Care Act, but anything else you're seeing out there that?
People are talking about animal spirits.
Did you bring a joke? I'm almost afraid, Doctor. I'm almost afraid. I'm sorry.
Yeah.
But you said I always like you. You're the one who said you always like that little joke.
Well, it's. I probably should not go there, but let me just say that the animal spirits that they're talking about and the breath of fresh air is I think palpable. I think small business is the lifeblood of employment in this country.
Yes, it is.
And it is where the country's heart is. And I think the small business people now see an opportunity going into the future with a radical alteration of the tax code. This tax code's a disaster. So getting rid of that tax code and having something that's fair and promotes growth and promotes hiring is just going to create a wonderful opportunity for a lot of folks in the country to have high self-esteem, good opportunities to be employed.
Well, I have gone and I'm not going to name any. I just wanted to get an idea of the feeling and the mood of people. And I've gone to several bankers in the local community in some different areas, and I've just walked in and said, hey, can I sit down and talk to you a minute? And we're not on the record. Can I just get what's the feeling of the people that are coming in the bank, small businesses, the people that, you need to get out there and watch, just sit at a bank and watch those bank bags come in, and it's mom and pop shops that are making their deposit. You know where I'm going?
Yeah. Yeah.
And that's where you connect with small business and where small businesses needed help from banks to grow, and Dodd-Frank regulations are this tough, you put them on the floor. And going into that, and every banker I spoke with said, the mood is definitely different in their customer base, small businesses that come in, optimism, people that are just saying out there, hey, I think I might put some of those plans in place or look at it. I think at the first of the year I want to come back after he's inaugurated. And I mean, this is what I heard over and over. Yeah. And the optimism. Well, Dr. Tidman, Merry Christmas.
Merry
Glad
Christmas
to have
to
you. And come back and see us anytime. I mean, we have a special segment on Fridays at 8:15, but that doesn't mean you can't come anytime, because I always enjoy it. And I'm not going to push you for your humor. And
I'll come better prepared next time.
no, it's not. I actually think you're prepared. You're just thinking, I don't think I want to do this.
Well, okay.
No, I don't want to get you.
Don't get me in trouble with the boss.
Hey, we're going to take a break. We'll be right back after this. Georgia Cancer Specialists. We want to thank them, cancer specialists in North Georgia. And Dr. Tidman's been with us. I'm your host, BKP. We're going to take a brief break. Did you get some breakfast, Cole? Yep. Are things better in your life now? Yep. Got some breakfast? Thank you, Mindy. Okay, take us to break, Cole.